That's technically difficult to answer. You certainly can get the symptoms of the disease.
Correct.
And then they'll argue, well, it's not the real disease because you're not infectious to somebody else. But we know that from the MMR vaccine, one of the common side effects, it's 7 to 10%. You can get the rash that we call it a 𝗵𝗲𝗯 rash. It's measles rash.
Welcome back. We're continuing our discussion on vaccines and the concerns that are being raised surrounding them. And listen, I know it's difficult when you're watching because you're hearing a lot of people talking and everybody seems to have thousands of studies talking about exactly what we are discussing. And on both sides, you've got doctor, you've got advocates, nurse practitioners. So it's very difficult. This show is not meant to give you a comprehensive review. Clearly, you can see Dr. 𝗵𝗲𝗯 and I are favor getting vaccines. What I want all of you to do when you're watching is look at the information all of us are presenting, go back and then do the research yourself and talk to your doctors and say, this is what's happening. Can you let us know what's going on? Joel, if parents want alternatives, they don't want to vaccinate their kids for whatever reason, what are the policies out there and what can they do?
Well, in terms of the policies with regard to not receiving vaccinations, we have in the state of Michigan an exemption program so that if you would like to attend school, which is the lever that's used to coerce parents into vaccinating, you can get an exemption for religious or philosophical or medical reasons. And this is a great state. There's only 18 states, I believe, still in the country that allow that. So our organization wants to preserve the right to make these choices, and we don't see the same danger that is often seen by someone like yourself. I mean, I'm not qualified to tell you, what to do. I mean, I know if you get the measles, you take vitamin A, and it is very helpful in reducing the impact of that.
Vitamin A will not make, just so you're watching, I will tell you, do not think that vitamin A is going to protect you from getting the complications of measles. It will not hurt you to take vitamin A, but it's not going to help you to not get encephalitis or die. People die of measles. I don't care what anybody says.
It's 1 in 1,000. Do we have to wait for that number?
But people die all over the world.
Do we have to wait for that?
So, but I let you have your say. I want to ask you this. I want to tell you this, is that for those who are watching, is that the reason why kids who are not vaccinated stay safe is with everybody around them doesn't have the disease. You bring a population, just go to Central Africa. Go to the kids in Central Africa where the disease is there. When you don't vaccinate them, a very different story than North America. We're an affluent society who've believed in vaccination for a long time. The moment that doesn't happen, things change. So he's right, because these kids choose not to. The word coerce is not the right term I would use. We use the word, try to have people understand that when you reserve the rights of your child, but it impinges on the rights of other children. They're in a confined area. Homeschooling, staying within your society, I guess that's somewhat acceptable, but the problem is that you're exposing the risk to my kids, and I might have a different belief system, and what happens is these kids come there. So that's an issue. Do you believe, Dr. New, that vaccines given for a certain disease to protect against that disease can actually give you that disease?
That's technically difficult to answer. You certainly can get the symptoms of the disease.
Correct.
And then they'll argue, well, it's not the real disease because you're not infectious to somebody else. But we know that from the MMR vaccine, one of the common side effects, it's 7 to 10%. You can get the rash that we call it a 𝗵𝗲𝗯 rash. It's measles rash. We also know with outbreaks like what they had at Disney World, about 38% of the people that had measles at that Disney World outbreak in California, 38% had the vaccine strain measles, because we have the technology now that we can dissect where that virus came from. We can say not just is it wild type or is it vaccine type, but we can say it's wild type from Central Africa or it's wild type from Israel or wherever it's from, because we have that technology now.
When you vaccinate someone, you're activating their immune response. So just so you know, what are you doing with the vaccination is activating their immune response, so you have a memory. So your body says, if this sucker comes again, I will attack it. So you will, occasionally, sometimes more than that, get the same symptoms of an infection. But I'll tell you that I feel like when people are faced with these dilemmas, you have to look at the facts and not be derailed on both sides with misinformation. I glean from this, is there room for improvement? Absolutely. Is it that the CDC schedule that's given now is completely 100% tested to the nth degree? Probably not, and we have some room for that. So there's room for debate, but I just don't want to lose any more kids. That's my problem, is I don't want to lose kids like you talked about from a disease that could be potentially decreased from vaccinations. Nothing's perfect, but we cannot lose any more kids. That's why we're doing this show, not to fight or debate or, you know, cause a stir, but it's rather to protect the kids. So thank you so much for all of you coming on. I know we don't all agree, but we do agree on one thing, is that we all want to protect kids. So how we do that is going to be, I think, resolved, but I appreciate all of your concerns. I think your hearts are all in the right places. Hi everyone, I'm Dr. Partha Nandi, and if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.